The National Health Service has come a long way in 70 years.
The NHS has improved the nursing care so much.
Generations of Britons have cherished its care, forgiven its flaws, and still consider it the pinnacle of public service.
To see that little badge, it's so much, doesn't it?
But like the country it serves, the NHS is changing.
So this is your blood pressure now. It's a little bit high.
Its 8th decade brings huge challenges and hard choices.
Half of our workforce is either on the cusp of retirement or above retirement age.
And to sustain it, we may have to change too.
It's my fault of putting on the weight, so I'd rather not have to burden the NHS with it.
The NHS is our best-loved institution, defining the national character like the weather or the landscape. But as it turns 70, is it fit for the future? The Kendal Ramblers Club, booting up for another assault on the Yorkshire Dales, are contemporaries of the National Health Service. The first generation to enjoy free healthcare, the NHS delivered their children, and in later life, it's tended to their ills.
I've had prostate cancer and a heart attack, so it's pretty important that you do whatever you can to keep things going. It's very clearly in great difficulties now. Last week I tried to get just a telephone appointment with my GP, and it was going to be almost 2 weeks before I could actually speak to a GP.
Here we are thinking, great, we're doing this walking because it's keeping us fit, we're going to live for longer. But is the care out there? Who's looking after us, and how are we going to afford it?
I was convalescing after prostate cancer, and the preliminaries and the operation and the post-operation service was excellent, and it's enabled me to have an active life since. 2.5 years ago my wife died, and for the fortnight that she was seriously ill there was, I would say, loving care of someone who was beyond recovery. So I'm a great supporter.
These retirees are not slowing down, but their generation, living 12 years longer on average than when the NHS was founded, and with more complex illnesses, is threatening to overwhelm the service.
This leaflet...
It's one of many challenges unforeseen when, from the wreckage of war, the NHS was founded as the jewel of Britain's new welfare state.
It tells you what the new National Health Service is.
So in 1948, I had been in casualty for 1 year when the National Health Service took over. The thing I noticed most was we began to get more doctors. We'd only had one casualty officer, and the poor man, he worked 24 hours a day. When the NHS took over, people could start to come into hospital for anything, so of course our workload increased immensely. That was my staff there.
Janet Hardingham was 27 and a nurse at Norfolk and Norwich Hospital. She spent the next 30 years in the NHS as it transformed healthcare.
The NHS has improved the nursing care so much because of the operations now. People are no longer in bed for any length of time. They're up and out, aren't they? Whereas our patients were in for weeks and in bed. Often they had to be nursed in the bed. And the operations that are taking place now, like heart operations, were only just beginning while I was working there.
Nearly 40 years after Janet retired, the fundamentals of nursing have not changed. But the NHS today faces huge challenges.
You relaxing? Okay, so this is your blood pressure now. It's a little bit high.
Rosario was recruited to Queen's Hospital in Romford directly from Italy because of a chronic shortage of homegrown nurses.
You had already.
Most of her patients are elderly and have a multitude of ills, like Ernest, who's 84 and relies on social care to remain at home. The ageing population is a huge new burden. There are as many patients in hospital with dementia today as there were with tuberculosis when the NHS was founded.
So he has had abdominal pain and vomiting for the past 4 days.
The daily demand of accidents and illness also has to be met. Richard is feeling sick, but not of the service that's come to his aid.
Fantastic. Absolutely fantastic. I should thank these boys, didn't I? You know what I mean? No, it is just like, it makes you feel proud to be English. You know what I mean? If you're going to be ill anywhere, you're going to be ill in this country, don't you? You don't use it that often, do you? But when you do, to see that little badge, it's so much, doesn't it?
Gratitude is one of the few commodities not in short supply, but staff and beds are, placing those on the front line under huge pressure.
The complexity and the workload of our patients, is immense, and the needs and the requirements is high. However, we have fundamental really good teams and people in place to really support and help that. We need to be mindful that there is an increase in demand and there is an increase in terms of, the acuity, how unwell our patients are that come to us, and we need to adjust and adapt to meet their needs as best as possible.
Technology has been transformed in 70 years too, but medical advances have increased costs.
Lovely. Yeah, thank you.
OK, David, you're all set. We're going to leave the room now.
This radiotherapy machine is the first of its kind in Britain, offering concentrated treatment in a fraction of the time of older technology, but with a multi-million-pound bill. It's a price worth paying, says David, who has prostate cancer.
It's not cheap, and these new machines are going to be wonderful for the cancer treatment. So, I know there is talk about the prospect of them more money coming into the NHS, and I think that would be a great thing if it can.
Despite investments like this, cancer is one area where NHS outcomes are worse than the European average. And British patients are more likely to die from stroke and heart attack than in comparable countries. Yet the public hold the system responsible. Support for nurses and doctors is unwavering.
Oh, that's very good.
The home nations have devolved control over health. Responsibility for reviving the NHS in England falls to Simon Stevens. He's got a 5-year funding deal worth up to £20 billion. Now he's working on a 10-year plan that will set out what the NHS will and will not do for the money.
The range of services that the health service offers is going to continue to expand. The way in which we interact with the health service will continue to change. But fundamentally, the deal is that we, as the citizens and taxpayers of this country, fund a service that will be available for us when we need it, and that's going to endure. There have been big reductions in waiting on the NHS over the last 10 years or so. We want to keep short waits for A&E care and for planned surgery, but we also want to make big improvements in cancer care and unaddressed areas such as young people's mental health services.
For most of us, the NHS means a GP, the family doctors in every town who've been both first port of call for everyday problems and gatekeepers for 70 years. In Darwin in Lancashire, as across the country, they are under pressure.
I think at least half of our workforce is either on the cusp of retirement or above retirement age and continuing to work. So yes, practices in the area have had problems recruiting, and it will get worse.
One solution, trialled across the NHS, has been to train the staff they do have to take on extra responsibility. Maria was a receptionist. Now she's an assistant practitioner.
The job entitles me to look after patients with more complex needs, so kind of the diabetic patients, patients with chronic disease such as diabetes, epilepsy, hypertension, chronic heart disease, learning disabilities, kind of the list is endless really.
The work being done down there in Darwin is part of the NHS's wider plan to deal with the challenges of today. In the jargon, it's called integration. In plain terms, it means getting services across a region to work together. Hospitals, GPs, crucially social care. And here, that means from the Lancashire mill towns to Cumbria, way up there in the north, right across to Blackpool on the west coast. A few miles away near Preston, the NHS is easing pressure on hospitals by taking advanced treatment into people's homes.
Hello, it's all the district nurses. Hello.
Rachel has been tetraplegic since a bus crashed into her moped when she was 16. She has 32 years' experience of the NHS.
A few years ago I had tendon transfers because as a tetraplegic you lose function in your fingers and your hands. They take tendons out of your arm, they split it and take it to your thumb so that, as you can see, I've got a grip.
She needs intravenous antibiotics for an infection, and until recently that would have meant 6 weeks on a ward.
It means that my life can go on as normal. I work part-time, so it means that I can get the IV done and still get to work. And really just my life isn't altered in any way. Hospitals are not the place for me, if I can help it.
Changing the way the NHS and its staff work is crucial, but there is one group that has more power than any to ensure it is sustainable. Us.
How are you, Joe?
Fine, thank you.
Want to stand on for me?
At this Weight Watchers Club, they're not just helping themselves.
There's some great techniques in there for mindfulness, mindful eating. It's not just us that are improving our lives, it's for our family as well. That ripple effect.
Almost 2/3 of us are obese or overweight, with increased risks of cancer and heart disease, and diabetes is an emerging epidemic.
The doctor told me I was borderline diabetic and he wanted to put me on all these tablets, and I said, no, I really don't want to go on medication. Give me 6 months and I'll see if I can do something myself. And I went back after 6 months and it was much improved.
I've got asthma and my mum had a bad chest and I was going the same way, kept getting chest infections and one thing and another, and the asthma were getting worse. So actually we're losing weight, that's helped a lot.
It's my fault of putting on the weight, so I'd rather not have to burden the NHS with it when they've got, you know, loads of other pressures.
As long as the NHS is free at the point of use, prevention will be the key to its long-term health. But changing lifestyles will not be enough without the funding and staff to improve care. 70 years since the NHS was founded, we still put our lives in its hands, but its future is in ours. Paul Kelso, Sky News.